Joe Biden's live television freezes weren't accidents. CIA's Blackout Protocol was activating. Every time a dangerous question was asked, every time there was a risk of revealing classified information, the president's consciousness was automatically shut down. Dr. Jennifer Walsh's leaked video footage showed the remote control device that had been controlling America's leader for 4 years. The first sign that something was fundamentally wrong with the Biden presidency came from an unlikely source, a television production technician named David Martinez working at CNN. During a live town hall broadcast in September 2021, Martinez noticed something that would eventually unravel one of the most sophisticated conspiracies in American political history. Martinez had been working in television production for over 15 years. He understood the technical aspects of live broadcasting better than almost anyone in the industry. But during that September town hall, he observed something that defied everything he knew about television technology and human behavior. President Biden had been answering questions from the audience when suddenly, mid-sentence, he stopped speaking and remained completely motionless for exactly 12 seconds. To viewers at home, it appeared to be a typical senior moment or perhaps a technical glitch. But Martinez, monitoring the broadcast from the control room, noticed something that others missed. At the exact moment Biden froze, Martinez observed an unusual electromagnetic signature on his technical monitoring equipment. The signature was brief but distinct, resembling the kind of signal that might be used for remote electronic device activation. More puzzling, the signal appeared to originate from within the venue itself, not from any of CNN's broadcasting equipment. Martinez initially dismissed the observation as a coincidence. But over the following months, he began paying closer attention to similar incidents during Biden's public appearances. Each time the president experienced what media described as a senior moment, or appeared to lose his train of thought, Martinez detected similar electromagnetic signatures. By early 2022, Martinez had documented over 30 incidents where unusual electromagnetic activity coincided with Biden's apparent cognitive lapses. The pattern was too consistent to be accidental, and the technical signatures were too sophisticated to be naturally occurring. Martinez brought his findings to his supervisor, who initially dismissed them as conspiracy theorizing. But when Martinez presented detailed technical data showing the correlation between electromagnetic signals and Biden's behavioral changes, his supervisor recommended he contact someone with expertise in electronic surveillance and government security systems. Through a colleague, Martinez was introduced to Dr. Jennifer Walsh, a former CIA technical officer who had worked on classified surveillance and mind control research programs before leaving the agency in 2018. Dr. Walsh had spent 12 years developing electronic systems for intelligence operations, including projects that involved remote monitoring and influence of human behavior. When Martinez presented his data to Dr. Walsh, her reaction was immediate and alarming. She recognized the electromagnetic signatures from her previous work on classified CIA programs. The patterns Martinez had detected were consistent with advanced neural interface technology that the CIA had been developing for over 2 decades. Dr. Walsh explained that the CIA's Technical Services Division had been working on projects involving remote influence of human consciousness since the late 1990s. These programs, developed under various code names including Project Mindbridge and Operation Cognitive Control, were designed to provide intelligence agencies with the ability to influence or temporarily disable the mental functions of targeted individuals. The technology worked by transmitting specific electromagnetic frequencies that could interfere with normal brain activity. Advanced versions of the system could induce temporary unconsciousness, memory loss, or complete behavioral control in subjects who had been prepared through previous conditioning or surgical implantation of receptor devices. Dr. Walsh had left the CIA specifically because she believed these technologies were being developed for use against American citizens, violating both constitutional protections and basic human rights. She had attempted to raise concerns through official channels but had been told that the projects were necessary for national security and were being conducted under proper legal authority. Now, seeing Martinez's data, Dr. Walsh realized that her worst fears had been realized. The technology she had helped develop was apparently being used to control the President of the United States himself. Working together, Martinez and Dr. Walsh began a covert investigation into what they termed the Blackout Protocol. They developed methods for detecting and recording the electromagnetic signals that preceded Biden's cognitive episodes, and they began mapping the sources of these transmissions. Their investigation revealed that the signals were being transmitted from devices operated by individuals who were always present during Biden's public appearances. These individuals were officially identified as Secret Service agents or White House staff, but their behavior patterns suggested they were actually CIA operatives responsible for implementing the Cognitive Control Protocol. The breakthrough in their investigation came when Dr. Walsh was able to intercept and decode some of the transmitted signals. Using equipment she had retained from her CIA days, she discovered that the transmissions contained specific command codes that corresponded to different types of behavioral control. Code Alpha 7 appeared to induce temporary paralysis, causing Biden to freeze in place until the effect wore off. Code Beta 3 seemed to cause memory disruption, leading to the confused or nonsensical statements that had become a hallmark of Biden's public appearances. Code Gamma 1 appeared to provide more comprehensive control, allowing the operators to guide Biden's speech and behavior in real time. Most disturbing was the discovery of Code Delta 9, which appeared to completely override Biden's consciousness, allowing the CIA operatives to speak and act through him as if he were a remote-controlled puppet. Dr. Walsh's analysis suggested that many of Biden's most important speeches and policy announcements had been delivered while he was under Delta 9 control. The investigation also revealed that the Blackout Protocol had been in operation since before Biden's 2020 election campaign. The technology had been used to ensure that Biden could function as a presidential candidate despite what Dr. Walsh's analysis suggested were significant cognitive impairments that would have otherwise disqualified him from office. During the campaign, the protocol had been used to help Biden navigate debates, interviews, and public appearances that might have revealed his actual mental condition. The CIA operatives could activate different control codes to ensure that Biden appeared coherent and capable during critical moments while allowing his natural confusion to show through during less important interactions. Dr. Walsh's analysis of Biden's debate performance against Donald Trump in 2020 revealed extensive use of the cognitive control technology. The electromagnetic signals detected during the debate showed that Biden had been under some form of remote influence for over 80% of the 90-minute event. The implications of these discoveries were staggering. If Dr. Walsh's analysis was correct, the United States had been governed for over 2 years by a president whose thoughts, words, and actions were being controlled by unelected CIA operatives. Every major policy decision, every international negotiation, every response to national crises had potentially been directed by intelligence agents rather than the elected president. Martinez and Dr. Walsh realized that they needed to gather more concrete evidence before they could expose the conspiracy. They began developing plans to record video footage of the CIA operatives using the control devices, hoping to capture visual proof of the Blackout Protocol in operation. The opportunity came during a White House press conference in March 2023. Martinez had convinced CNN to allow him to operate a secondary camera position that would give him a clear view of the area where the suspected CIA operatives typically position themselves during Biden's public appearances. During the press conference, when a reporter asked Biden about classified documents found in his personal residence, Martinez observed one of the suspected operatives reach into a briefcase and activate what appeared to be a small electronic device. Simultaneously, Biden froze mid-sentence and remained motionless for 15 seconds before resuming his answer with completely different content than what he had been saying. Martinez's camera captured the entire sequence, showing the operative's actions, the timing of Biden's freeze, and the subsequent change in his behavior. The footage provided the first visual evidence that external control was being exercised over the president's actions. Dr. Walsh's analysis of the footage confirmed her suspicions about the technology being used. The device operated by the CIA agent was consistent with advanced neural interface equipment that she had helped develop during her time at the agency. The timing and nature of Biden's behavioral change matched exactly what would be expected from activation of the cognitive control system. With this evidence in hand, Dr. Walsh and Martinez faced a crucial decision. They possessed proof of what appeared to be a conspiracy to control the President of the United States through unauthorized use of advanced mind control technology. But they also knew that attempting to expose such a conspiracy would put them in extreme danger from the intelligence agencies involved. Dr. Walsh decided to contact a former colleague who had also left the CIA due to concerns about unethical operations. Dr. Michael Chen had been a senior analyst in the agency's counterintelligence division before retiring in 2020. He had maintained contacts within the intelligence community and had the expertise to help verify and contextualize their findings. When Dr. Chen reviewed the evidence that Walsh and Martinez had gathered, his reaction confirmed their worst fears. He revealed that rumors of unauthorized CIA operations targeting American political leaders had been circulating within intelligence circles for several years. The Blackout Protocol appeared to be part of a broader program designed to ensure that elected officials remained under intelligence agency control. Dr. Chen explained that the program had its origins in legitimate national security concerns about the cognitive fitness of aging political leaders. The CIA had developed the technology as a safeguard to prevent cognitively impaired officials from accidentally revealing classified information or making dangerous policy decisions. However, according to Dr. Chen's sources, the program had evolved far beyond its original scope. Instead of simply preventing security breaches, the technology was being used to actively control policy decisions and ensure that the government operated according to intelligence agency priorities rather than democratic will. The conspiracy apparently involved multiple levels of the intelligence community, with different agencies responsible for various aspects of the operation. The CIA handled the technical implementation of the cognitive control, while other agencies managed the cover-up and the elimination of potential whistleblowers. Dr. Chen warned Walsh and Martinez that their investigation had likely already been detected by intelligence monitoring systems. He advised them to immediately secure their evidence and prepare to go public before they could be silenced by the agencies involved in the conspiracy. Working quickly, the three investigators compiled their evidence into a comprehensive package that included technical data, video footage, and Dr. Walsh's expert analysis of the cognitive control technology. They prepared multiple copies of the evidence and arranged for its simultaneous release through several independent media outlets. The decision to go public was complicated by the sensitive nature of the allegations. Claiming that the President of the United States was being controlled by mind control technology was exactly the kind of assertion that would be dismissed as conspiracy theorizing unless supported by overwhelming evidence. Dr. Walsh used her contacts in the scientific community to arrange for independent verification of their technical findings. Several experts in neuroscience and electromagnetic technology confirmed that the signals they had detected were consistent with advanced neural interface systems and that the behavioral changes they had documented could indeed result from external electromagnetic influence. The story was first published by an independent investigative journalism website that specialized in intelligence agency oversight. The initial article included the video footage of the CIA operative activating the control device, Dr. Walsh's technical analysis, and statements from the independent experts who had verified their findings. The reaction was immediate and explosive. Within hours of publication, the story had been shared millions of times on social media platforms. Mainstream media outlets initially attempted to debunk the story, but the technical evidence proved difficult to refute. The White House issued immediate denials, claiming that the allegations were baseless conspiracy theories being spread by enemies of democracy. But the denials were complicated by the fact that the video evidence clearly showed unusual activity by individuals positioned near the president during his cognitive episodes. Intelligence agencies initially remained silent, but within days of the story's publication, government sources began leaking additional information that seemed to corroborate some aspects of the conspiracy. Current and former CIA employees, speaking anonymously, confirmed that advanced neural interface technology had been developed and that it had been tested on various subjects. Congressional oversight committees announced immediate investigations into the allegations. Several senators and representatives demanded access to classified CIA programs related to neural interface technology and cognitive control systems. Dr. Walsh, Martinez, and Dr. Chen were called to testify before closed-door congressional hearings. Their testimony, combined with the technical evidence they had gathered, convinced several key legislators that the allegations required serious investigation. However, the congressional investigation faced immediate obstruction from intelligence agencies citing national security concerns. CIA officials claimed that revealing details about neural interface technology would compromise ongoing operations and endanger American agents overseas. The investigation was further complicated by the fact that many of the technologies involved were classified at the highest levels of government. Even members of Congress with top-secret clearances were told that they lacked the necessary authorization to review the relevant programs. As the controversy continued to develop, additional evidence emerged from unexpected sources. Former White House staff members came forward with accounts of unusual activities and restricted areas within the White House that seemed to support the cognitive control allegations. Secret Service agents, speaking anonymously, described receiving orders to position themselves in specific locations during presidential appearances and to operate electronic equipment whose purpose they had not been told. Medical personnel reported being excluded from areas where the president received what were described as routine health assessments, but which occurred with suspicious frequency and secrecy. The international implications of the conspiracy gradually became apparent as foreign intelligence services began releasing their own assessments of American leadership behavior. Several allied nations confirmed that they had noticed unusual patterns in American diplomatic communications and policy decisions that seemed to support the cognitive control allegations. Most significantly, intercepted communications from hostile nations revealed that they had been aware of the American president's compromised condition and had been attempting to exploit it for strategic advantage. The cognitive control conspiracy had apparently weakened American national security by making the country's leadership predictable and manipulable. As investigations continued, the scope of the conspiracy became increasingly clear. The Blackout Protocol was not an isolated operation but part of a broader program that had compromised democratic governance at multiple levels. Other elected officials, including senators and representatives, appeared to have been subjected to similar forms of technological control. The revelation that American democracy had been undermined by its own intelligence agencies created a constitutional crisis unlike anything in the nation's history. The question of who had actually been governing the country for the past several years remained unanswered, and the legitimacy of major policy decisions was thrown into doubt. Dr. Walsh's investigation had revealed not just a conspiracy against a single president, but a fundamental attack on the principles of democratic government. The technology that had been developed to protect national security had instead been used to subvert the will of the American people and concentrate power in the hands of unelected intelligence operatives. The long-term implications of the Blackout Protocol scandal would reshape American politics for generations. The revelation that advanced technology could be used to control elected officials highlighted the need for new forms of oversight and protection for democratic institutions. For Dr. Walsh, Martinez, and Dr. Chin, the decision to expose the conspiracy had come at enormous personal cost. All three faced ongoing threats and harassment from unknown sources, and their professional lives were effectively ended by their whistleblowing activities. But their investigation had succeeded in revealing one of the most significant threats to democratic governance in American history. The Blackout Protocol scandal demonstrated that the tools developed to protect democracy could also be used to destroy it, and that eternal vigilance was required to preserve the integrity of democratic institutions. The case ultimately showed that in an age of advanced technology and sophisticated intelligence operations, protecting democracy required not just guarding against external threats, but ensuring that the guardians themselves remained accountable to the people they were sworn to protect.